भोपाल के चिरायू मेडिकल कॉलेज एंड हॉस्पिटल में 10 से 12 अप्रैल 2025 तक 3 दिवसीय ऑन्कोपैथ वर्कशॉप और सीएमई का आयोजन किया गया। ये कार्यक्रम एसोसिएशन ऑफ पैथोलॉजिस्ट एंड माइक्रोबायोलॉजिस्ट भोपाल द्वारा आईएपीएम मध्य प्रदेश चैप्टर के तत्वावधान में आयोजित किया गया। इस शैक्षणिक आयोजन में देश भर से कई प्रसिद्ध विशेषज्ञ शामिल हुए। मुंबई की कंसल्टेंट हिस्टोपैथोलॉजिस्ट डॉक्टर अनीता बॉर्जेस, टाटा मेमोरियल हॉस्पिटल मुंबई के प्रोफेसर और हिस्टोपैथोलॉजिस्ट डॉक्टर सुमित गुजराल, प्रोफेसर डॉक्टर मुक्ता रामद्वार, गायनिक मेडिकल ऑन्कोलॉजिस्ट डॉक्टर जया घोष, प्रोफेसर डॉक्टर केदार दियोधार, मस्कोस्केलेटल ऑन्कोलॉजिस्ट डॉक्टर मनीष पूर्थी शामिल हुए। विद्यार्थियों और प्रोफेशनल्स के लिए ये कार्यक्रम जानवर्धक साबित हुआ।
Doctors, because young doctors are already inspired to become young doctors. What we have come here to do is to help those who are already in practice, okay, and of course those who are postgraduates in pathology. We are here to help them to use whatever resources they have to come to a diagnosis in histopathology. Now, what is histopathology? I'll tell you. Histopathology, which is what I actually practice, and Dr. Sumit Gujral practices, and Dr. Rini Malik practices, and also Dr. Farah practices. This is a science of where tissues which are removed from the body, the clinician, the surgeon, the physician wants to know what is that disease. So it's not like a blood test. So we're not testing body fluids or blood. Actual tissue that is removed is looked at grossly, that means with your eyes, and then there is a whole way that it is processed in the department of histopathology. Okay, and histo actually means tissue. So it is a tissue pathology, and we've got some experience now in how to diagnose what these things are, and just a broad sort of category. See, I practice in cancer, so does Dr. Gujral, okay, and cancer is becoming a very prominent disease, and we need more and more histopathologists who are expert at being able to say that this is a tumor, but the tumor is cancerous or not cancerous. Okay, and for that you need some degree of expertise. Also, the world is changing. There are newer technologies, and you might have heard that there is something called molecular pathology and so on. And so a lot of medical colleges, people who practice in society who do histopathology are somewhat disappointed that they cannot have access, or their skills are not supported by these newer technologies. And they get more than disappointed, they are often frustrated. They feel that their skills are getting rusty, etc. So what Dr. Gujral and I have done, and thanks to Chirayu Medical College, Professor Rini Malik and also Professor Farah Jalali, we have who are somewhat experienced in how to tell what is a cancer and what is not a cancer, and if there is difficulty in doing this, how to go ahead and solve that problem. Okay, so that's what we do, and we have been going from all come together, and we learn together. And how do we learn? Yes, we have a bit more experience than the people over there, but we are used to doing things in a very high technology environment, and therefore we need to understand what is happening in relatively low technology environments and how we can help people in low technology environments to improve their skills. And that's what we did. But we asked people from the regional colleges to bring their interesting cases. Sometimes they have difficult cases, etc., and share it with everybody. And if we can help them to do better, that's what we are doing. Okay, so in some ways, it's like a traveling school of pathology. So we are the ones who travel from place to place rather than have people come to us. Because over the years, we have realized that when people come to high technology environments, they are unable to implement what they see in a high technology environment in the field. And they're literally laboring in a field with some support, sometimes with inadequate support. And they feel, as I told you, rather frustrated that they are unable to do what they saw in a high technology. So, in a way, we are here to help them to improve their skills, up their game, as they say, by looking to see what little loopholes in their support systems, etc., can be easily filled by just looking at things that may have escaped their attention. That's all. It's not really, bringing a great deal of technology with us. But if they have technology or they can have access to technology, then this is the right technology for you for this particular case. It's the wrong kind of technology for that particular case. Or perhaps you don't need any technology at all if you had only done a little bit of studying that case more diligently. Okay, so this is what we're doing. And so the message that we have to the medical colleges, and we're hoping that those medical colleges that we visit will become like, there is a word for it, a nidus, around which, that information will travel in ripples. So we are expecting Chirayu now to, on their own, help other medical colleges around to get them together so that they can have their individual little discussions and so forth. And whatever help we can give, not from being there, in a physical presence, we are always there to give. So that's what we're doing. But to come back to your question as to what we are doing for young people also, it's important for them to realize that experience comes from hard work. So, number one, they have to work hard, but they should not feel paralyzed because they don't have access to high-end technology. There is so much you can do without access to high-end technology. So what you need to understand is, these are the areas where I need the high-end technology, and these are the areas where I can do very well and help patients without high-end technology. So it's a message of encouragement that don't feel frustrated. Don't feel that I can't do anything in this place. They can only do it in Tata Memorial Hospital, where Dr. Gujral is from. They can only do it in the Center for Oncopathology, where I am from. No, use your God-given skills, and the skills that I think that are very important is an analytical skill, and that is intelligence. Every one of them is intelligent. Now use your analytical skills, which is your intelligence, and pick up your game. And soon you will realize that there is a lot that I can do, which I thought was not possible given my status and where I am. Okay?
Thank you so much, ma'am, for your inspiring words.